Alright, so I'm going to start with range of motion. We're going to do dorsiflexion and plantar flexion. So, is it right? Did you?
Yes, sir.
So I'm going to put the fulcrum on the patient's lateral malleoli, and we're going to have the stationary arm in line with the fibular head, and the moving arm in line with the fifth metatarsal of the foot. So go ahead and do that. And I'm going to teach the patient to go into dorsiflexion, which is bringing your toe up, teaching that motion, and then we'll go ahead and, so do you think you understand that? Okay. Normal should be 20 degrees. And the patient has 15. So now we're going to plantar flexion range of motion.
Down.
Yeah, exactly. So just as straight as possible. So I'll teach him the motion right now. So I'm going to put the fulcrum once again on the same place, lateral malleoli, stationary arm in line with the fibular head, and the moving arm following the fifth metatarsal parallel. So go ahead and do that motion. Normal should be 50 degrees. And it looks like he has 53, so that's pretty good. And then, so we'll go into manual muscle test for dorsiflexion with the component of inversion. So we're going to teach him dorsiflexion again, and then teach him, as he does that, kind of bring his foot in. And so go ahead and do that. So I think he can do that against gravity on his own, so that's a 3. So now we'll actually do that again. Stabilize the back of the tibia, proximal to the ankle, palpating for tibialis anterior. Go ahead and do that again. Okay, yeah. So again, that's a 3. And now we'll provide resistance down and out. So let's go ahead and do that. So I'll begin to provide resistance. And I want you to hold that. Okay. So he was able to hold against maximum resistance, so that's a grade of 5. So while we're here, we'll jump to a manual muscle test of hip flexion. So I will teach the patient the motion first. So what you're going to want to do is just lift your knee up and kind of bring it towards the ceiling, so that it's kind of like that. Yeah. Think you understand? So try to do that. Yeah, just try to keep it straight as much as you can. Alright. So I was stabilizing the pelvis and palpating iliopsoas as he did that. And I believe he was able to do that against gravity, so that's a 3. So now we'll provide resistance just proximal to the knee, so go ahead and do that. We'll do that again. Oh, and you can use your arms to help stabilize as you do that. Go ahead and do that. Try to hold and fight. Okay. So I think that was 4 resistance. That was moderate. So while we're here, actually, we will move to the bed, so you can lay down on your back with your head over here. Yep. So first I will measure hip flexion. So you're going to want the fulcrum on the greater trochanter of the femur, and which I'll palpate right now is just distal, the iliac crest, and it's a big bony prominence. So is it right if I kind of stick my hand on my shoulder?
Yes, sir.
So it's just that big bony prominence just below the iliac crest, towards the proximal femur. Thank you. So I put the fulcrum on the greater trochanter, and the moving arm will be in line with the femur and to the lateral condyle of of the femur, and I'll palpate that and the lateral epicondyle of the femur, just proximal of the fibular head. Is that tender? Does that hurt when I touch it? No. So it's non-tender. Okay, so I'll go ahead and teach the patient hip flexion. So basically, you're just gonna want to bring. So you can bend your knee as you do that. So you're just gonna want to bring your leg like that, and you're gonna kind of want to go just as much as you can, but don't force it. Okay, so you can put the fulcrum on the greater trochanter of the hip, and then moving arm in line with the femur following, and the stationary arm following in line with the trunk. So go ahead and do that. Normal is 120 degrees. You can go ahead and put it down. It looks like he has 122. So that's good. We will also do knee flexion in this position. So you're just going to want to, you were stabilizing at the pelvis while you were doing the flexion. And then you're just going to, this is pretty much the same. You're going to bring your hip up, and then you're going to bring your knee in. And I'm going to grab a towel, just bottom of this heel. And this time the fulcrum will be on the lateral condyle of the femur. Stationary arm in line with the femur, and the moving arm following the fibula towards the lateral malleoli. Okay. So you can go ahead and produce that motion. Normal is 135 degrees. It looks like, you can go ahead and bring it like that. It looks like the patient has 125, so just a little bit lower, but I think that's due to a lot of muscle tissue. And from here we'll go on to hip adduction, goniometry. So for this one, the fulcrum will be on the ASIS of the patient, with the stationary arm in line with the opposite ASIS, and the moving arm following the femur. So I'll go ahead and do that. I'll teach the patient the motion of hip adduction. So you're just going to want to bring your leg as much as you can, keeping your knees straight, and try not to use your trunk, your abs to do that. So just try to do as much motion as you can, without using other muscles. And I'll stabilize at the pelvis. So go ahead and do that. Moving arm following the patella. Normal is 40. Looks like my patient has 34. Okay. And then for next we'll do a strength test for adduction. So we'll have my patient sideline, so just roll over to your side. No, on this side. On this side. So for this, I'm going to hold up this leg, and I want you to bring this leg up to the ceiling, so kind of like this. Just do that. Side plank. Yeah, kind of, yeah. So go ahead and try that. And then back down. And then, go ahead and do that one more time. Palpating for adductors, longus, magnus, and brevis. And I believe you can do that against gravity. So that's a score of 3. And now I'll provide resistance just proximal to the knee. So go ahead and try that. Okay, that's good. And that was definitely maximal, so that's a grade of 5. So now we'll do a manual muscle test for eversion of the foot. Okay, so you're going to roll over onto your other side. Sorry. And then you can move this leg down, up the way a little. And what we're going to do is I'm gonna teach him eversion, so I'm gonna teach him just use his foot to point up to the ceiling, bringing pinkies to the ceiling. Okay. Stabilizing proximal, the ankle, and a little bit posterior, palpating for the peroneals.
Rotating? Or
No, just your foot, so just no rotation,
okay.
just right there. So I'm gonna palpate for the peroneus longus and brevis. Oh, actually, can I take off your sock as well? Because I also want to palpate for the tendons as well that go down to the cuboid and to the base of the fifth metatarsal. So go ahead and do that. Well, you can relax one more time. That's good. So I was palpating the tendons for the peroneal tendons as well as feeling the contraction. Was that painful or did it hurt?
No.
These tendons? Okay. So non-tender for those tendons, and I believe he did score a grade of 3. So now I will begin to provide resistance just outside of the foot. So go ahead and do that again. Now we can. Okay. So I think that was maximum resistance, so that is a grade of 5. Okay, so now we'll do the last one. So I'll have you roll down onto your stomach. And then I want to teach the patient the motion of knee flexion for manual muscle test. So I'm going to stabilize just posterior to the pelvis, and all I want you to do is bring your knee like that. Okay? Is that good?
Yeah.
Okay, so I'm going to palpate the hamstrings as he does that. So go ahead and try that. Okay, go ahead. So I believe he can do that very well, so that's a grade of 3. So I will begin to apply resistance. So what I want you to do is just bring your knee to about like 90, about to right here. And just hold it right there, and I will begin to apply resistance this way, and I want you to fight it.
Okay.
So go ahead and do that. So, you ready?
Yep.
Okay, go ahead. And then, okay, so I think that was good. Maximum resistance, so that's a grade of 5. Palpating the hamstrings, everything was good.
Okay, cramp.
Oh, sorry. He almost got a cramp, but he's alright. Alright, so that concludes our treatment.